Howdy y'all, welcome to my Poop Tip Tuesday, yay! Every Tuesday, I answer your questions you guys have sent me on social media, on DMs, and also through my email newsletter. I try to go through every week to answer your questions you guys have, to go over any tips and tricks, and also ask anything that you want to ask me. I want to make sure I can address it in these videos. So the best way to know is to make sure you subscribe to my newsletter. Every couple of weeks or months, I send out a survey which you can get information to know exactly what's going on for your gut, but also more importantly, so you can let me know what questions you have so I can answer these questions on the Poop Tip Tuesdays. And if you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, like I said before, don't forget to subscribe to my channel and newsletter where you can get great tips and tricks like you're learning in today's video. If you're watching for the first time, my name is Dr. Islam, and yes, I am your gut microbiome expert and your poop guru. My passion is to give you, yes you, the best tips and tricks so you can live your best life. If you haven't already, you need to subscribe to get more information like you're learning in today's video. All right, we have a slew of questions we're gonna answer in today's Poop Tip Tuesday. Let's go ahead and begin. So first question somebody asked, are bananas a gut superhero? Well, I can't imagine that, you know, Mr. Banana, here for the rescue. That's a great picture there. But let's talk about bananas. So bananas are a fantastic source of a lot of vitamins and minerals and potassium when it comes to gut health. In fact, yes, I would say that bananas are a gut superhero. Bananas are fantastic. They are low calorie, they're chock full of fiber, chock full of minerals and vitamins, and they're fantastic to keep you full, but also to give you some of the nutrients that you need. And what it does really good with is that it actually helps out when it comes to diarrhea. So it's a really effective nutrient and a natural food to help out when it comes to gut issues. In fact, for a lot of my patients that have a gastroenteritis or some diarrhea, I do recommend taking a banana to help out when it comes to replenish their gut microbiome, to replenish their nutrients, and to get them feeling better. So let me know in the comments down below what your experience has been with bananas. Has it worked? Has it helped out with your gut issues? Because I can tell you for a lot of my patients, it does work well. And an added benefit is that a lot of our patients that have, cramping in their legs, bananas are an effective way to increase the potassium to help decrease the cramping. So if you're having cramping issues, banana is a way to go. Great question. Question number 2. Hey, Dr. Islam, I think I have gas, but I'm not sure. What is going on? So gas pain can be such a common problem that a lot of people have. A lot of us have gas pains, and sometimes we're wondering, hey, is this really gas or is it something more ominous? Let me know in the comments down below if you felt this way, or if you feel like this has been an issue as well. So what exactly does gas pain feel like? Well, the pain from gas can come and go, but obviously it just feels like pain. Typically, it's in the upper part of your abdomen. Most gas that you have is produced in the small intestine, which is kind of in the upper part here. And so your pain typically will be in the upper GI tract. Now, usually with this gas pain, you'll notice your belly getting physically bigger. Yes, for a lot of my patients, they complain about themselves just looking like they're pregnant, and they have some pain and some tightness from that. Now when it comes to gas pain, it typically will come and go. So most gas pain, as the gas progresses through the gut or maybe goes out of the body, it'll progress to and go down as well. Now, sometimes gas pain is not just gas pain. You have to kind of keep that in mind. So gas pain typically will get worse with certain foods or worse with meals, because typically it's a food trigger that'll bring on this gas pain. What gas pain will not do, it will not be associated with severe pain, and gas pain should not be there all the time. Gas pain, because it's air, will come and go, but it should not be there all the time. The pain should not be severe, and typically the pain will not be lower as well. Now, you also may have associated gas pain if you're constipated, so keep in mind your whole GI tract is one long tube. When one part of it's clogged up, it will cause backflow of gas and stool further up into the GI tract, even manifesting inside your upper GI tract as well. So sometimes gas pain can get better once you have a bowel movement. But there are a couple things I keep an eye out for when I have somebody coming to me for pain to let me think, hey, this may be more than just gas pain. So number 1, a new change in bowel habits. If you have gas pain plus a new change in how your bowels are doing, whether it's more diarrhea or more constipation or just changing in general, that is not normal when it comes to gas pain. Number 2 is weight loss. You should not have weight loss when it comes to gas pain. That is not normal. Something else is going on. Number 3, like I mentioned before, if that gas pain is constant and severe, that's not gas pain. No way. Something else is going on that needs to get further investigation to make sure nothing else is happening. Then lastly, if you have gas pain with bloody bowel movements, that is not normal. It does not matter whether you think those bloody bowel movements are hemorrhoids or not. You should not be having gas pain with blood. Completely abnormal, does not make sense, and that should not be the case. So if you notice that, make sure you do further investigation to find out exactly what's going on. And if you want to know what to do, the best thing is to speak to your doctor, speak to your healthcare provider, maybe even consider getting a scope done so we can see exactly what's going on and get you taken care of. Next question. Hey, Dr. Islam, I use Miralax. Is that okay? Is that safe? Is that okay to do? I love this question because I get so many questions about Miralax, the safety of it. Is it okay to use? Can I use it long term? Why do I recommend it? So Miralax is the go-to medication for millions of gastroenterologists. I love it as a first-line treatment when it comes to constipation for my patients. Here is why I like it. Number one, it's not absorbed. It stays in your gut. It doesn't get absorbed to the rest of your body. It is gut localized, doing a directed action where it needs to do its best effect to hopefully get your bowels taken care of and help out when it comes to constipation. Number two, it's a non-motility agent. Unlike some other agents that are out there, it does not change the contraction of your gut. It does not move things further. It doesn't interfere with the natural course of bowel movements. It doesn't change the rhythm of what your body normally does. Number three, there is no dependency risk. This is a very common question. You can take Miralax for years and not have any risk of getting dependent on it. It does not lead to a lazy colon. It does not lead to a cathartic colon. It doesn't lead to anything bad. It just helps out when it comes to constipation. Let me know in the comments down below if you have a question about Miralax. But here's the question I want to ask you guys, or the thing I want to really clarify. When it comes to constipation, I don't want you to feel like you just have to take Miralax alone. I want to find out the root cause of why you're having constipation. Is it a diet change? Is it medications? Is it a condition called IBS? And so I want to find out exactly why you're having these issues so I can pinpoint what's going on. And the answer may be yes, take Miralax and that's okay. But maybe we can change your diet. Maybe we can add some supplements. Maybe we can alter some things. Maybe change your lifestyle to hopefully get you going and get you flowing. So I don't want you to feel like that you are just stuck with Miralax alone. There may be other options. So come see someone like me. Come see me personally so we can help it when it comes to your constipation issues. All right, last question. Hey, Dr. Islam, I think I have an intestinal parasite. What do I do? Oh, I love this even more because I get this question all the time. I see stuff on social media all the time about get this cleanse to clean out your body to get rid of parasites. You have a parasite, here's how we can diagnose it. Buy my product. Oh my gosh. Let's get the lowdown of intestinal parasites. So number one, intestinal parasites are very rare. Unless you're traveling someplace in an endemic country that has a lot of parasites, if you live here in the US and you don't travel outside the US on a consistent basis, it's extremely rare for you to get an intestinal parasite. So don't jump to that as the first line thing that you have. It's very common on social media, but rare in real life. Number two, make sure you get the right test to see if you have this. Don't all of a sudden jump to taking some sort of supplement or some sort of herbal treatment to get you going to cure what's going on. You need to get full and true diagnostic testing so we can see exactly why you think you may have a parasite. And stool testing, checking your stool is the best way and the primary way for us to see not only do you have a parasite, but what type of parasite you might be having, because the treatment for each parasite can be very, very different depending on what we think is growing inside your body. Number three, the symptoms of parasites can vary, but the most common one being pain, change in bowel habits, weight loss, and diarrhea. But keep in mind, those symptoms can be due to so many other things that are more common than having just a parasite. So don't diagnose yourself with a parasite just on symptoms alone. Next, treatment for parasites should be evidence-based and based on actual literature and prescribed by a medical professional. I want to stress this. Don't get a prescription for a parasite cleanse from a social media influencer that has no credentials. Don't get a parasite cleanse from a chiropractor. Get it from a doctor or a healthcare professional that's trained in this, that knows exactly what they're doing. Don't be duped into trying to buy something that's going to cleanse out your body and treat something you may not have. Now, there are some examples of natural treatments that do work, but I want to stress this has to be under the supervision of a medical professional. These include herbal remedies like wormwood, black walnut, and even garlic. And then lastly, beware of the dangers of taking a supplement or an herbal treatment without a true diagnosis. So many people are misdiagnosed with parasites, get treatments that don't get them feeling better, but also can lead to severe complications and severe problems down the road. Don't be like that. Don't cause more issues, more stress, and more pain for yourself and your family without a true diagnosis. All right, guys, so thank you for watching. If you want to get more questions like this, if you want me to answer your questions, comment down below, send me a DM. But the best way is you subscribe to my newsletter, where every couple of months I'll send a survey to my audience to answer any questions they may have. So if you want a question answered, let me know. I'd love to hear what you guys have to say. Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter. Send me a question so I can answer those on future videos. Thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.